Now, I've said this on the show before, we don't shy away from topics that you may not bring up in an everyday conversation. So ladies, today we've invited Dr. Victor Chen with Genesis OBGYN here to talk about a treatment option for painful symptoms that we can experience post-menopause. And doctor, that is probably correct. This isn't a over coffee conversation.
Absolutely not, absolutely not.
So that's why we're talking about it today, to kind of address. When I say symptoms, what does that really mean? What are some of the symptoms we could experience?
Well, some of the with declining estrogen levels in menopause, some of the symptoms, of course, include hot flashes and night sweats and sleep disturbances. But probably one of the most troubling aspects associated with menopause that may occur later on is associated with a condition called vulvovaginal atrophy. So this is a condition where, because of declining estrogen levels, patients can experience vaginal dryness, pain with intercourse. They can experience irritation, sometimes even bladder symptoms, which includes painful urination and frequency. And so these are symptoms that can be quite distressing to patients, and those are symptoms that sometimes are not addressed because we don't talk about it.
Exactly. And so we like to come with a solution, for some of the things that we maybe are not bringing up. So what are some of those treatment options?
Well, so traditionally, many of the treatments are medications. So these are estrogen medications, a lot of times applied directly into the vagina, such as creams and tablets, and there's a ring as well. Or oral tablets, systemic estrogen therapy, or related products. The problem is that some of these medications have side effects or adverse effects and can't be used by all patients, especially breast cancer survivors. Breast cancer survivors can't use estrogen products because of the risk of recurrence. So with those limitations, we're missing a significant portion of the population that can be helped, which is why the Mona Lisa Touch is such a wonderful procedure that will bring a lot of promise to these women.
Well, tell me more about that, because I think that you're right. There's a large population that is needing this.
Sure. So the Mona Lisa Touch is a fractional CO2 laser that is applied into the vagina with a special probe. You can see there on the screen. And these, there's small perforations in this probe, and it allows us to be able to apply the laser in a very superficial manner to the surface of the vagina lining. So these little micro perforations cause cellular regeneration, collagen growth, increased blood flow, and with all of these things, it can help to reduce the symptoms associated with the dryness, so improve lubrication, elasticity, and comfort in general. And so it's a very nice procedure that we do in the office.
Now, if somebody hasn't heard of this, kind of giving them maybe a little background on what is maybe some of the scientific proof of the success? Yeah,
so we actually have microscopic evidence to show the differences between the pre-treatment and the post-treatment. So on the left side, you can see that the tissues look pale. The cells are all shrunken. It's not a healthy looking lining. And then after the treatment, post-treatment, you can see this robust growth of new generation of cells. You can even see the colors are more vibrant because of the staining, and they take up the stain. And so it's just a much healthier tissue, much like premenopausal condition. And so, this is something that we've actually demonstrated histologically. But also, this technology has been studied throughout the world. We're a little behind the U.S. here to catch up, in many different countries with very high effectiveness and basically minimal to no side effects or risks associated with this procedure.
Well, I love to see that we have the science to kind of back what we're looking for. And I'm sure probably one of the first questions you get from a patient is it painful? Is the treatment painful?
Right. So most patients report little to no pain. This is a procedure that we do in our office. There's no anesthesia involved. And most patients describe maybe a little bit of a tapping or a pressure sensation when they have this procedure done. It's a series of 3 treatments that are done 6 weeks apart. And most patients will notice an improvement after the first or second treatment. So the nice thing about it, there's no downtime, there's really no discomfort. Patients can drive themselves home, and there's no restrictions on any activity at all. So patients bounce back very quickly, and they do just fine.
So obviously we've had a lot of patients that have come in. You said, they're seeing a difference in a couple of treatments. Really, what are you hearing back as far as like the impact on their lives?
Well, loss of intimacy associated with menopause is a really it's a sad thing because, I mean, it's an important part of a lot of people's relationships, and it not only affects the patient, but also her spouse and, you know, their relationship. So, so it has the potential to really make a huge impact on these patients, and especially younger patients, breast cancer survivors who are made menopausal through surgery or chemotherapy or treatments, and patients who are recently menopausal, where intimacy is such an important part of their lives. So we have an opportunity to make a tremendous impact with these patients. And even if patients are not sexually active, there can be some benefits associated with some of the irritation associated with vulvovaginal atrophy, and also with the bladder symptoms and the frequency and all that. So I'm very excited about this technology because I think it shows tremendous promise. Actually, it has already shown tremendous promise, but we can help so many women who are otherwise you know, not going to be able to have an improved quality of life.
Well, and I feel like we could talk about this a lot here, but I do have to let you get back to doing your doctor duties. But you guys have a great opportunity for people that do have questions and want to learn more coming up soon.
Yes, we do. We have an open house on Tuesday, December 5th at our Genesis Northwest office. And you don't have to be a patient of ours. People can call in, and the phone number on your screen there, get some more information on our website. And we actually encourage patients who have a partner and spouse who are interested to bring your spouse along. We'll have some snacks, and I think you know, the partner should be involved in this decision-making process and find out more about the information.
That's right. We're going to start the conversation that we maybe otherwise would not have had.
Right.
Doctor, you've already given us a lot of information. I want to thank you for your time.
Well, thanks for having me.
I'm going to remind them how to get a hold of you one more time for that information.
Sure.
Oh, thank you so much. The information open house and physician presentation is happening this coming Tuesday at 5:30 in the evening at 6261 North La Jolla Boulevard, Suite 277. For any questions, please call 520-795-0771 or go online to genesisobgyn.net.